I know they gave us drugs at the time to counteract some of the chemo side effects, which is nausea, but it's very difficult to get rid of that sickly feeling. Even though I wasn't actually physically sick, I was very lucky.
There are a few things that you can do for yourself if you're feeling nauseous or vomiting. If you feel sick or vomit, please tell your treatment team, as there are drugs we can give you to help you feel better. If your anti-nausea medication doesn't work, your doctor will prescribe a different one for you. Relaxation exercises such as deep breathing can also help to reduce nausea. If you have been vomiting, it's important to drink plenty of fluids so you don't get dehydrated. This also helps to flush the chemotherapy from your body. Also, experiment with different foods to see which ones you can tolerate the best. Different things work for different people.
Every morning they'd give me a water jug, and I don't like plain water. And I think, how am I going to drink this 2 litres of water? And then I met another patient, and she was about 3 weeks ahead of me, and she'd come in for a blood test. And she had green cordial. And I said, how come you've got green cordial? Are you allowed to drink green cordial? She's like, yeah, sure, we can drink anything we like. And I'm like, wow, I didn't realise that it counted as a fluid and I could actually drink green cordial.
I did go off certain foods which I probably never thought I'd eat again, like bananas. Was very aware of that, and even food ads on the television used to make me feel quite ill. I used to come home and it was a bit like Meals on Wheels. My mother would prepare a few meals for that week or the first few days, just till I could cope with cooking, cope with the sense of smell, and maybe even have a bit of an idea of what I wanted.
I ate very plain foods, and I tended to just prepare that before I'd come for chemo so that I had something when I went home.
The few days after chemo, I used to eat white grapes and fresh white bread and not much else. I picked a lot, which I guess is the way to go. I think when you're having chemo, you need to indulge yourself, look after yourself, spend time doing things that you want to do, and eating what you feel like.